Speaker 1. Male clear American voice. Hey there, future doctors. Today I'm here to demystify one of the most essential tools in critical care, the blood gas analyzer. Understanding how this device works and how to interpret its reports is crucial for diagnosing and managing patients effectively. So, let's dive right in. First things first, what exactly is a blood gas analyzer? Simply put, it's a device that measures the amounts of oxygen, carbon dioxide, and acidity, or pH, in the blood. These measurements are vital for assessing a patient's respiratory and metabolic status. Alright, let's break down how this machine works. You draw a blood sample, usually from an artery, and the analyzer runs it through various sensors. These sensors measure different components like pH, partial pressure of oxygen, PO2, partial pressure of carbon dioxide, PaCO2, bicarbonate, HCO3, and oxygen saturation, SaO2. Each of these parameters gives you a snapshot of the patient's blood gas status. Now let's talk about the test report. When you get a blood gas report, you'll see a lot of numbers and abbreviations. Don't let that intimidate you. Here's how to read it step by step. First up, pH. This tells you how acidic or alkaline the blood is. The normal range is 7.35 to 7.45. Low pH, acidemia, if it's below 7.35. Respiratory acidosis, due to high PaCO2, metabolic acidosis. Due to low HCO3, diabetic ketoacidosis, lactic acidosis. Symptoms, confusion, lethargy, rapid breathing. High pH, alkalemia, if it's above 7.45. Respiratory alkalosis, due to low PaCO2, metabolic alkalosis. Due to high HCO3, prolonged vomiting, diuretic use. Symptoms, muscle twitching, hand tremor, lightheadedness. Next, PaCO2, 35, 45 mmHg. This is the partial pressure of carbon dioxide and reflects respiratory function. High PaCO2, hypercapnia, if it's above 45 mmHg. COPD, respiratory failure, drug overdose, depresses breathing, sleep apnea. Symptoms, drowsiness, confusion, headache, shortness of breath. Low PaCO2, hypocapnia, if it's low 35 mmHg. Hyperventilation, for example, anxiety, panic attacks, pulmonary embolism. Symptoms, lightheadedness, tingling in extremities, palpitations. Moving on, we have PO2. This measures the partial pressure of oxygen in the blood. Normal range, 75, 100 mmHg. Low PO2, hypoxemia, if it's low, 75 mmHg. Chronic obstructive pulmonary disease, COPD. Pneumonia, pulmonary edema, asthma, heart failure. Symptoms, shortness of breath, rapid breathing, cyanosis, bluish skin. High PO2, if it's high 100 mmHg. Typically due to excessive oxygen therapy, not common in diseases. Then there's HCO3, or bicarbonate. This represents the metabolic component and helps regulate pH. Normal levels are 22 to 26 mg/L. Low HCO3, metabolic acidosis, if it's low 22 mg/L. Diabetic ketoacidosis, renal failure, severe diarrhea, shock. Symptoms, rapid breathing, fatigue, confusion. High HCO3, metabolic alkalosis, if it's high 26 mg/L. Excessive vomiting, diuretic therapy, antacid overuse. Symptoms, irritability, muscle twitching, slow breathing. Values outside this range suggest metabolic acidosis or alkalosis. Oxygen saturation, SaO2, is next. This tells you the percentage of hemoglobin that's saturated with oxygen. A healthy range is 95% to 100%. If it's low, 90%. Hypoxemia, due to respiratory diseases like COPD, pneumonia, anemia, heart defects. Shortness of breath, chest pain, confusion. Base excess, BE, indicates the excess or deficit of base in the blood. Normal range, -2 to +2 mg/L. Negative base excess, base deficit. Metabolic acidosis, diabetic ketoacidosis, lactic acidosis. Rapid breathing, confusion, fatigue. Positive base excess. Metabolic alkalosis, excessive bicarbonate intake. Muscle twitching, hand tremor, nausea. Rapid diagnosis. Blood gas analyzers can provide results in just a few minutes, which is crucial for diagnosing and managing critically ill patients in emergency and intensive care settings. Microsample volumes. Modern blood gas analyzers require very small blood samples, sometimes less than 100 microliters, making them suitable for use in neonatal and pediatric care where blood volume is a concern. multiple parameters. In addition to the primary gases and pH, many analyzers can also measure electrolytes, for example, sodium, potassium, calcium, and metabolites, for example, glucose, lactate, providing a comprehensive assessment of the patient's metabolic status. Point-of-care testing. Many blood gas analyzers are designed for point-of-care use, meaning they can be used at the bedside, in operating rooms or in emergency departments, allowing for immediate decision-making and treatment adjustments. Portable and handheld devices. Advances in technology have led to the development of portable and handheld blood gas analyzers, enabling their use in ambulances, field hospitals, and remote locations. Calibration and quality control. Blood gas analyzers require regular calibration and quality control to ensure accuracy and reliability. Automated systems in modern devices help maintain this without significant user intervention. Impact on mechanical ventilation. Blood gas analysis is essential in managing patients on mechanical ventilation. It helps in adjusting ventilator settings to optimize oxygenation and carbon dioxide removal. Arterial versus venous blood gases. While arterial blood gases, ABGs, are the standard, venous blood gases, VBGs, can sometimes be used as an alternative, particularly when arterial sampling is difficult. However, VBGs have limitations and are typically less accurate for certain parameters like PaO2. Historical development. The concept of blood gas analysis dates back to the 1950s when the first blood gas analyzer was developed by Severinghaus and Bradley, revolutionizing critical care and respiratory medicine. Educational tools. Blood gas analyzers are also used as educational tools in medical and nursing schools to teach students about respiratory physiology, acid-base balance, and clinical diagnostics. Customized panels. Some blood gas analyzers allow customization of test panels, enabling healthcare providers to select specific tests relevant to the patient's condition, improving efficiency and reducing unnecessary testing. Technological integration. Modern blood gas analyzers can be integrated with electronic medical records, EMRs, allowing for seamless data transfer and better tracking of patient results over time. Putting it all together, you can determine if the issue is respiratory or metabolic and whether it's acidosis or alkalosis. For example, if the pH is low and PaCO2 is high, it's respiratory acidosis. If pH is high and HCO3 is high, it's metabolic alkalosis. Remember, interpreting blood gas reports is like solving a puzzle. Look at all the pieces, pH, PaCO2, PaO2, HCO3, and SaO2, and see how they fit together. With practice, you'll get the hang of it. Alright, that's a wrap on blood gas analyzers and reading their reports. I hope this guide has made things clearer for you. Keep practicing and soon you'll be a pro at it. Thanks for watching and stay curious.